I'd like to talk a little about robotic FUE, in comparison with traditional handheld FUE. Now, it's understandable that there's a research trying to invent a robot that actually does the repeated motion of the human being precisely and without having the problem of fatigue. But current technology has limitations. That's what we have to understand. And when we look at the current FUE robots, we see a few things. Although it's very high tech, it has some difficulties, and these difficulties could be listed as follows. First of all, the initial cost of the robot is quite high, and together with that, the company charges per each extraction attempt. So when a clinic uses a robot, you don't only have to buy this very expensive machine, but you actually have to pay per each extraction that is done. Now that means a very significant cost. Now, I don't know how it would work in other Western countries, but in Turkey, it's absolutely impossible that the robot becomes feasible as a business instrument. There's a couple of clinics that have bought this, but I see it as merely a marketing tool because the prices in Turkey would not allow for actually selling a robotic FUE transplant. So that's about the costs. There's also technical difficulties. What the robot does, it just does the isolation. So what happens is that they set the head, they make grids, and they put the robot so that it sees that grid, and that does like shotgun-like attempts to isolate each graft. Now, although it's quite high technology, it's very difficult to give the robot the multiple parameters of extraction. That's the depth, the softness of the tissue. There's no RPM. We change the RPM when we do manual extractions. The angles and everything. It's also mentioned that when there's difference in surface, it has difficulty in getting adapted to that. So when they extract from the very middle, where it's quite flat, but on the sides and corners, it's very difficult. And it needs someone to operate on because it just does the isolation. The extraction of the grafts have to be done manually by someone else. So, I've never used a robot, but my impression is that the robot is either recruited by mostly strip surgery only clinics where there isn't a skilled FUE surgeon that can do it manually. So it's not there because it's better than the surgeon, but it's there because there's no surgeon to do it. In other clinics, it may be used as a marketing strategy. So it means we use a robot in FUE has quite good marketing value, but when you look into practice, they will either not always use it or only a part of the extractions will be done by the robot and then a surgeon takes over. So basically, I think this technology is quite promising for the future, but yet it's not sufficient enough to replace a skilled surgeon.